when a fetus is mature enough to survive on its own, it begins to release hormones into the mother's bloodstream, where they meet up with hormones produced by the mother. This new hormonal balance signals the uterus to begin contracting gently, sometimes unnoticeably. Prostaglandin also helps to soften the cervix, the opening to the uterus. This process is known as ripening. When your body is gearing up for labor, you may feel the kind of low backache or abdominal cramping that comes with a menstrual period. You may have soft bowel movements or diarrhea, or some stomach upset. Many women feel a sudden burst of energy and a pressing need to finish preparing for their baby's arrival. You'll know you are progressing toward labor if you have blood-tinged discharge, leaking of amniotic fluid from the vagina, or contractions which at the beginning may come and go with no real pattern. Throughout pregnancy, thick mucus fills the cervix. As the cervix softens in preparation for labor, the mucus plug is released a little at a time, or occasionally all at once. You may pass a small amount of blood with the mucus plug. Bloody show sometimes occurs days before any other sign of labor. Amniotic fluid may leak from your vagina before labor really begins. Sometimes the membrane seals over and the leaking stops. And sometimes the membranes, also known as the bag of waters, break. Surprisingly, the waters break at the start of labor only about 11% of the time. If your membranes rupture or leak before you are in the hospital, you should call your healthcare provider, who will want to know the time it happened, if the amount of fluid was a leak or a gush, and whether or not the fluid was clear or if it had any color or odor. Remind yourself that each contraction, whether gentle or hard, tells you that your uterus is doing its job, and every one of them moves labor along. No one knows for sure what a baby feels during a contraction. We do know the fetal heart rate goes down just a little with each squeeze, and then quickly recovers. Some suggest that the sensation may be like an all-over body hug. Here's a look at an average pattern of contractions over the course of labor. Before labor is fully established, contractions may last between 25 and 40 seconds and come as many as 20 minutes apart. Then they might increase in frequency or slow down again. Contractions will gradually become more intense and more frequent. When they start to come every 5 minutes for an hour or so, they may last 40 to 60 seconds. Notice the time there is to regroup and relax between contractions. The time for birth is near when contractions are just 1 to 3 minutes apart and last as long as 90 seconds. Most labors involve only 12 to 20 contractions like this. Keep in mind this is an average and that no woman's experience is exactly the same. Contractions do their job gradually. The first stage of labor, in which the cervix opens to allow the baby to move out of the uterus, takes the longest amount of time. The last part of the first stage of labor, when the cervix is dilated 8 to 10 centimeters, is called transition. The second stage of labor begins when the mother feels an urge to push. Now, her efforts to bear down with her contractions guide the baby through the vagina. The third stage of labor, after the baby is born, includes the delivery of the placenta and the beginning of the process of involution, in which the uterus begins its return to its pre-pregnant size. Here's a more detailed view of typical events in childbirth. Keep in mind that there are plenty of normal variations in this sequence. Usually, the baby positions itself late in pregnancy so that its head is down and facing the mother's side. This position permits the easiest fit into the pelvis. Sometimes women notice that they breathe easier when a baby drops into position. This is often called lightening. Fetal descent is measured by station, a term used to describe the position of the baby's head in relation to two particular bones in the mother's pelvis. In late pregnancy, before lightening, when the baby drops, the head may be floating above the inlet to the pelvis at -4 station. Engagement is when the top of the head has dropped to the middle of the pelvis. The baby is then at 0 station. The lowest station is +4 and means the baby has moved all the way through the pelvis and is about to be born. As labor begins, the cervix looks like a pair of puckered lips at the entrance to the uterus. Gradually, with the pressure of the descending head and with contractions pulling it upward, the cervix thins out. This thinning process is called effacement, and your doctor or midwife will measure it in percentages during vaginal exams. Your cervix will go from 0 to 100% effaced. Contractions during the first stage of labor also allow the cervix to open or dilate. Dilation is measured in centimeters from 0 to 10. At 1 to 2 centimeters, the opening is about the width of one fingertip. Fully dilated, that is, at about 10 centimeters, the cervix is open wide enough to fit the full width of the baby's head. In most cases, in active labor, the baby begins a turn toward his mother's back. This turn allows the baby to present the narrowest part of his head through the widest part of the pelvic outlet. When the baby is facing his mother's back, he's ready to leave the uterus. As the mother responds to her urge to bear down, the baby stretches out his neck and upper body. Once his head is born, he turns it back to the side as he emerges. Now the width of the shoulders slip into the widest part of the pelvis, and then birth. Unlike baby Jade, about 1 in 4 babies starts labor facing the front rather than turned toward his mother's side. In this position, the hard, bony part of the baby's skull presses against the mother's sacrum, or lower back, as the baby descends during labor. Active labor may be longer in such cases, because the baby has to rotate more to get into the desirable position of facing the mother's back.
What you gonna do? Go to sleep? You need some help?
Head's all bruised.
Is it? Push the sucker bowl. I do want to stick it in his nose and see if I can get some stuff out.
That's it. He didn't take over it.
You can call them and tell them.
You want to turn this off?
No, you can keep it on.
Alright. You're the pregnant. I'm not pregnant.
you hear me screaming?
Yeah, but who cares?
Y'all did it!
You did it!
All by yourselves! That's so awesome.
Look. Mm. Mm.
The water didn't break till right before.
Yeah?
Yep.
The water broke, she pushed like 3 times.
Mm.
Sounds like felicity. You can be a printer.
So what color is his eyes?
I didn't really get it.
Your first one. Oh, it's too bright, Daddy. How you feeling, Mama?
Hey, yo,
I
man.
feel alright. Was it cord around his neck?
Yeah.
It was?
I just unwrapped it.
Mm. Mm.
You get to hold him right away. He's not like whisked away and he's such a little round head.
Yeah, it's a fairly round head.
You pulled the felicity out.
That was when I first heard you, was when you said, oh my goodness, there's his head.
Hey, baby boy.
How different are you from in there? Because when I first heard it, right before 2 minutes, it was like a...
Can you see? Do you need to turn the light on?
Yeah, I can see. I'm just trying to stay in my shadow. Hey, Lazel. What's up, little man?
His breathing is so perfect. You can tell you got everything out, you know?
Well, I didn't do anything. I mean, I grabbed the sucker just to kind of clean out his nose because he sounded congested. But
Yeah, but that's what I mean. You guys were able to...
There's my shadow again.
Put him in the drawer.
At 11:34
34.
p.m. He shares a birthday with his cousin Garrett.
As you prepare for childbirth, it's good to remember 2 important things. First, every woman experiences and copes with labor differently. And second, no 2 labors are alike. Some are real physical challenges. Others are easier to manage. Some are very long. Many are shorter than you might think. The average first labor lasts 14 hours. It helps to keep an open mind about labor. You may have never imagined yourself bouncing gently through contractions, but you may love the birthing ball. You may think you want to walk all through labor and then find yourself most comfortable settled in a hot shower or tub. You won't know for sure until you get there. Pain management techniques like breathing and relaxation, and comfort measures like hot compresses, a bath, movement, massage, and companionship provide many women with the resources they need. For others, medication or anesthesia is necessary or preferred. But because any medical procedure may affect your labor, your baby, or how both of you feel after birth, it is important to ask your healthcare provider about what the effects might be and how long they may last.